Dr. Huffaker, I wanted to ask you a few questions today regarding liposuction, which I kind of feel like most people know what liposuction is. It's a pretty common name now. But I guess the big question everyone always wants to know is how much fat can you take off with liposuction? Buckets?
Buckets. Quite a bit. It really depends upon how much fat you have to offer. The more fat you have, the more we can take off. Somebody comes in 105 pounds, obviously we're not going after bulk fat, we're going after refinement of small little areas to enhance the physique. The typical patient that comes in is perhaps a size 12 or size 14, maybe a 16, and we can take 5 to 6 liters out on someone like that too. That's about a gallon and a half. So quite a little bit of fat. So that they'll see quite a difference. The usual areas that we suction on the average patient that comes in, which is general physique, is the abdomen, the hips, the flanks or along the sides of the chest, and frequently the lower back and the outer thighs, inner thighs. Sometimes we do the knees, but less often. Sometimes the lower calves, the lower legs and calf areas, but less often.
So what areas can you have liposuction?
The areas that you can do are virtually everything. You can suction almost anything. You could even suction the breast if you wanted to, but we don't do that very often. It's not very effective. Arms are a frequent place, the tummy, hips, flanks, knees, lower calves, back, upper back, lower back on that. So you can suction almost any place.
What about the face?
We suction the neck and the lower cheeks sometimes. We don't like to suction high in along the cheekbones here because we like to leave fullness along this area. So most people have fullness that we want to get rid of is along the jawline here, so we can redefine the jawline a little bit better and suction along the neck here if we need to.
So how big are the incisions for liposuction?
The incisions for liposuction are perhaps maybe 1/8 of an inch. In some areas they may stretch out to about a 1/4 of an inch because of just the stretch from the suction, but they're really very tiny. We try to put them in as inconspicuous of an area as possible to hide them. Most of these are in areas that no one is ever going to find. They're really very tiny.
Now, there's a lot of different types of liposuction that's available. UAL, SAL, PAL, probably some of the ones I haven't even heard of yet. What's the difference? Is one better than the other? Is it a doctor preference or a patient preference?
I tell patients, pick your surgeon, don't pick the technique. Just like a good photographer can take a picture with almost any camera, a good surgeon can work with almost any tool. But there are differences. Years ago I used to use a lot of ultrasonic. Now ultrasonic, the machine is called the Vaser, V-A-S-E-R. I personally don't like the Vaser. Some people use it. It's a good machine. I just don't prefer it. There are some problems with ultrasonic. I haven't done a lot of this in the past. I use the power-assisted liposuction equipment from Micro Air. I think this is a much more efficient system to use. It's a little motorized arm. Its advantage is that it has different sizes of cannulas. It has different types of tips on the cannulas or the tubes that we use to suction fat with, so it's a very versatile tool. It doesn't generate any heat. It's a blunt tip cannula. The problems if you have with ultrasonic is that it generates heat and you sometimes can burn the tissue on the inside. Whereas with the power assisted, you can stay in the area as long as you need to stay in to remove the fat you want to remove, and you're not generating any heat. You're not going to need to get any fluid built up there, so it's really much safer in that respect. The problem with some of these other little, what I call piddly non-surgeon techniques, use laser and some other things. They're really out there for marketing hype, and in my opinion, if you have a sharp instrument, you're going to cut blood vessels or nerves, and so if you have a laser type instrument on the inside, you're going to do some damage. Yeah, you can melt some fat, but you're going to do some damage to other structures. The ultrasonic or the power assisted does not really damage the nerves or vessels on the inside. it leaves all those structures, and it's just much safer, much better. I just get better results with the PAL than I ever could before the power assisted.
So how painful is liposuction? I understand there's quite a bit of swelling and bruising.
Well, we use something called the tumescent technique. Tumescent technique is where you infuse large volume of sterile salt water, and we mix that with some local anesthetic. Even though we're doing this with you asleep, we mix some local anesthetic in so it doesn't hurt so much when you first wake up. We also, the main thing is that we mix it with some adrenaline, epinephrine, and this decreases bleeding, and so we get less bruising and bleeding when we do this. We can be more aggressive with the liposuction when we use tumescent fluid than we could otherwise. So it works out much better, but you do get a little bit, but it's not normally solid black and blue or as much bruising as what most people realize or think of it as possibly being. As far as pain goes, it normally feels more like a real hard workout. There's stiffness and soreness you get if you worked out real hard and you're just stiff and sore. Your fat layer doesn't have many nerve endings underneath the skin. And so even though it may look kind of brutal to somebody watching this, you really don't, you're not going through the skin except for little tiny areas, and so there are just not many nerve receptors in the fat layer itself, so it doesn't hurt as much as you might think it would hurt.
So when can someone return to work?
It depends a little bit on how much we take out. If it's just a little minimal liposuction, they can return to work the next day or two. The standard one that I mentioned earlier, where we're taking out 4 or 5 liters, 6 liters, they probably are going to have to wait at least to the 5th day to go back. You get a little lightheaded the first couple of days sometimes when we're taking out larger volumes of fat. It just takes a little while for the body to get back to where you're comfortable being. And then you have to realize if you're on your feet 8 to 10 hours, it's not easy. So if you wait till about the 5th day, you'll do much better if you try to go back on the 2nd or 3rd day.
So can the fat come back after liposuction?
It won't come back in those cells we've removed. We've removed fat cells and it's not going to come back. All people have a finite number of fat cells. That's pretty well fixed by the age of 18 months. So that if you gain weight after liposuction, you're likely to put it on in other areas, and less in the area because there's simply fewer fat cells in the areas that we suction. So we encourage people to not gain weight, but it's not the end of the world. For most people, it turns you into more of a normal weight gain, weight loss, because everyone has their little hereditary fat cells that they tend to gain weight in with the first or second priority. And then when you lose weight, it comes off last from those same areas. With liposuction, we've taken out most of those areas because a lot of the cells we take out are in those first and second priority areas. And so you'll have less of those and you'll be more of a normal weight gain, weight loss pattern after that.
So if you do gain weight, does it go to different areas?
Sure, it can. You just will gain weight less in the areas that we've suctioned.
So, you mentioned that you could, liposuction out quite a bit, but how many pant size can you lose with liposuction if you do the abdomen?
Typically, if we do the abdomen, hips, thighs, you'll lose 2 sizes. Unless sometimes people are busting out, they really should be in the size above, but they're not. So, but typically 2 sizes is about where women go.
So what about after pregnancy? Can someone just have liposuction to get rid of that little pooch?
It depends. Occasionally that's all they need. Most of the time after pregnancy they'll need a tummy tuck. It's just because the skin's been loosened and the skin just will not tighten up. Sometimes the muscle won't tighten up. But most of the time after pregnancy, liposuction alone will not work. But it does sometimes. It's just like age is sometimes an important issue, but some women come in 50 that have as good a skin as somebody in their 20s. So it just varies from person to person. So the best thing is just to come in and let us take a look and see what's what.
So what do patients tell you after surgery when they come back in? What difference, what change do they see?
They see a lot of their sins reversed. A lot of these women have sort of, they've had some weight issues. They gained more weight than they've liked. Maybe they've gotten away from exercise. This just sort of helps to push the reset button. It gets them back to an earlier point when they had less fat, and gives you another chance to regain control of your body and to stay thin.